Today I'm going to talk about abdominal pain and just how we think about it in Chinese medicine. Um, Abdominal pain can be a whole number of different things in Chinese medicine. And what I really want to focus on today is those cases where in Western medicine we don't have a clear answer or a clear diagnosis. And you're left as a patient kind of wondering, what do I do from here? Um, there's a lot of cases where we do a lot of studies, blood work, x-rays, CAT scans, endoscopies, a whole battery of tests, and it doesn't come back with a satisfying answer. And as a patient, it's even more unsatisfying on your end because you're the one who has to actually live through the problem. And and so the question kind of becomes, well, what do we go from here? And a lot of times in Western medicine, you might get a vague diagnosis like, okay, maybe you have reflux, or maybe you have IBS or irritable bowel syndrome or something like that. Or sometimes a doctor might say you have functional abdominal pain, meaning there's no real clear answer as to why you're having it. And sometimes they might say you have just a viral illness or something, and you never get a real clear identification. And even worse, you don't have any clear treatment that can help it get better. And that can be very frustrating when that's what you have to go through on a daily basis or weekly basis, monthly basis for long periods of time. And so, what I want to talk about is just how we think a little bit differently about some types of abdominal pain in Chinese medicine. And the one I want to talk about today is something called glomus. And glomus in Chinese medicine is referring to a pain that's happening in the abdomen. It oftentimes is in the upper abdomen, sometimes in the lower abdomen. And this type of pain does not have any hardness to it. Like when you press on your belly is soft. It doesn't have any sort of like masses or any sort of resistance areas. When you press your belly, it just goes down softly, but yet you feel that pain. And that's in contrast to other types of pain that we classify in Chinese medicine, where you can actually palpate something concrete or something hard or a mass or a lot of tenderness when you touch specific points. But glomus is it's a soft type of pain. And in Chinese medicine, we call that a formless qi stagnation, a formless qi stagnation. And there's a whole host of different types of things that can cause that. And I want to give an example of just one type of pathology today. And that's when you have what we call a complex of hot and cold disease happening together. And so in these circumstances, typically the digestive process in Chinese medicine is related to the proper functioning of the spleen and stomach. And although they may have some correlation to the organs we think about in Western medicine, they're different. It's a different idea. So when I say spleen and stomach, don't immediately think about the organs that we think about in Western medicine. But in Chinese medicine, the spleen and the stomach are responsible for the digestive function of the body. And so those are two organs that they have a downward working function and also a lifting function, and they have a warmth that they need to function properly. Now, there's a specific type of glomus that I'm going to talk about today where you can have a hot and cold pathogen that form together within that middle part of your body. And that prevents the spleen and stomach from doing its normal digestive process and functioning properly. And when that happens, you can get a distension that happens, and it causes your stomach to kind of feel kind of bloated. It's like I said, it's still soft when you press on there. And what happens is this cold gets lodged within that spleen stomach, and it can also combine with the heat. And when that happens, it prevents the qi from circulating properly in the spleen and stomach. When the qi is not circulating properly in the spleen and stomach, the spleen is supposed to be lifting the clear fluids from the digestive process, and that gets impaired. And the stomach is like what's supposed to be descending the food down towards the intestines, and then that gets impaired. And so you end up having, you can have nausea, you can have vomiting, you can have diarrhea type symptoms. You can also just have a lot of belching. You can feel a lot of rumbling in the stomach or borborygmus. All of these things can happen when that whole process gets disrupted. You might have all of those, you may have none of those, you might have different symptoms that are still related, but not exactly what I described. It can cause a whole host of different symptoms. So when you have abdominal pain, and this can go on for months and for years for people. And like I said, some of these things you won't necessarily see on your typical traditional allopathic medical testing. And so this is where I think Chinese medicine has a real benefit in being able to diagnose other types of disorders that are happening and being able to fix this. So, for example, in this type of case where you have heat and cold combining together, we can use a formula called Xia Xie Xin Tang, which has a number of herbs that are both hot and cold, and they work together to dislodge that blocked complex of heat and cold and to help drain it downward and help to restore the normal digestive process. And so I think this is a great option for you if you have never been able to find a clear answer for abdominal pain. For a lot of people, it's very disabling. You might be out there in the middle of the day trying to do regular activities, and all of a sudden you just get hit with this abdominal pain and you don't have anything to do. You've tried other medications, Imodium, Tums, all kinds of things, and not finding relief for it. If that's you, I would recommend you to check out Chinese medicine and what Chinese medicine, acupuncture, and herbal medicine can do for you, and give it a shot. If you want more information on our clinic, you can visit us at www.houstonacupuncture.com, and we'll see you next time.